my PCS also gets worse with PMS for sure. Like that's a huge thing because again, PMS is that point where your hormone levels go down, both your estrogen and progesterone. That again exposes underlying hormonal issues and underlying hormonal imbalances. So oftentimes the first thing I'll notice in patients is that their PMS is a lot worse after their concussion in their PC, and even years out, they've had, all of a sudden bad PCS. Again, a big sign that your hormones is something that you should be testing and getting looked at. And that probably has a big role to play. Again, if not at the root cause for your symptoms, possibly in creating, if I can borrow a term from Dr. Mark Gordon, who's like a guru in interventional endocrinology, to create a neuropermissive environment for your brain to heal. Your hormones can create a neuropermissive environment that allows your brain to heal.